Yo, step in the vibe, it's the plug with Toya T. Unlocking dreams, we got the master key. We talking real talk, yeah, your destiny. Sis, you got the juice, let it pour, you see. Glow up vibes, stacking cash, what's good? Mind on right, we moving through the hood. Love and grind, keep it real, no cap.
The plug with Toya T, now picture that.
No ceilings here, we breaking through.
The plug with Toya T, got the game for you.
Big goals, big dreams, yeah, we staying true.
Tap in weekly, we got the vibe on cue.
Glow up vibes, stacking cash, what's good? Mind on right, we moving through the hood. Love and grind, keep it real, no cap.
The plug with Toya T, now picture that.
Hey y'all, it's your girl Toya T, and do we have a great episode for you today? This was inspired by a friend of mine's story, and so I'm excited to get in and really go under and see what's going on with this whole stroke awareness topic. We do have to say thanks to MediLift, our platinum sponsor. And with that, I'm going to go ahead and welcome my guests in and have them introduce themselves. Come on in, guys. Hello.
Hello.
Thank you so much for being here tonight. I know you could be anywhere, but you're here with us, so we're glad to have you. I'd like to first have you just do a brief introduction. If we could have Rachel go first, because it's always ladies first here at the plug.
Absolutely. I'm Rachel Campbell. I'm a registered nurse and a stroke navigator at a local hospital, Jewish Hospital, Cincinnati, in the tri-state area.
Nice. Well, thanks again for joining us. And next, Joyce, if you could just do a brief introduction.
Hi, I'm Joyce Hyde, Joyce Hyde Creations. Just here to just give some encouraging words today.
All right. And Joyce is our stroke survivor, so we're going to talk a little bit about her journey. And last but certainly not least, Dr. Kachoris, can you introduce yourself?
Yes, hi, I'm John Kachoris. I am a neurologist with River Hills Neuroscience in Cincinnati. And for the last 4 years, I've been pretty much full-time at Jewish Hospital as the director of neurocritical care and working on building our stroke program there at the hospital.
All right. Well, thanks again. We appreciate you guys coming on tonight. So I'm curious, and I always ask this question when I meet people. I like to understand how they got involved in the work that they're doing and how long they've been doing it, because obviously you love it when you've done it for so long. So if you can tell us a little bit about what you do and how you got involved.
I guess I can start. I was a registered nurse. I graduated in 2016 and started at Jewish Hospital in 2017, working at the bedside in the intensive care unit. So Jewish Hospital has always kind of been the neuro hub of Mercy. And I was very familiar with working with this population, with the neuro population. And then my daughter, when she was 15 years old in 2019, was in a motor vehicle accident and sustained a traumatic brain injury. So, she was hospitalized for over 60 days. Part of that was in the acute care setting, where she was at UCNSICU, recovering from her injury after surgery and everything. And then she spent the next 30 days at Cincinnati Children's Hospital in the acute rehab unit. So watching her recover from that neurological insult was truly amazing and inspiring in itself. I mean, it was life-changing for her, me, and our entire family. And it really gave me a passion for this population. And I wanted to work more with the neuro population.
Wow. And to think that you got the training before she even needed, right?
I know it was very different, because in the acute care setting, I just saw, it was immediately after the insult that I would see these patients. They would experience a stroke. We would get them through the acute phase of care, and then they would move on with our wonderful therapist and, go to inpatient rehab or, other facilities. So I never got to see the full progression and recovery of what that insult looked like. So watching my daughter go through that, I was like, wow, our brain is such an amazing organ.
Right.
Right. So it was,
and you don't realize how intricate, right, your brain is until you have some type of injury like this, or you watch somebody close to you go through it. Uh,
Exactly.
Joyce, I know
Exactly.
you've gone through a stroke. What was your experience?
Um, uh,
How long has it been, and what was that like for you?
it's been almost 15 years now that I had my stroke, and um, just only through God's grace that I made it through it. It just, my stroke just affected the right side of my facial area, and I had right side paralysis, which caused me to have physical therapy to learn how to walk again. I could remember at the time that I did have my stroke. I did that. They told me that I wasn't. The neurologist told me that I was never ever going to be able to speak properly again because I wasn't able to speak properly when I had my stroke. So me recovering from it and going through it was a struggle because I had to chew gum. I had to just practice, of having the same feeling that I didn't have before that so it can come back.
Mm.
So I could understand what you're saying about your daughter and you being in the position that you're in. It was real helpful for her. I went through that by myself, and it was an unknown experience. It's something that I wouldn't want anybody to go through.
Right. Because
So
you feel like a stranger in your own presence. Like as I'm walking through it with my friend, it's like the things that she could do, she just
it,
can't do.
yeah,
And
it's
she
just like
doesn't
it's just like
understand
it's a dark
why.
cloud. It's just like you in a dark cloud and you're in a box, and it's just so much you can't just you want to try to do or make the movement to succeed, but it's real stressful, you know.
Mhm.
And the only way
Yeah,
that I made it is through medication, through therapy, and seeking, just going, checking, listening to my doctor. So I'm fine now. So I'm just blessed
absolutely.
today. Yes.
Speaking of your Doctor Kachors, how did you get involved in this work?
Sure. So, that's obviously a very long story because medical school and all the training goes
Right.
on for years and years. So I'll do it in big chunks. What got me wanting to even go to be a doctor at all was I'm from Chicago and I was a paramedic in Chicago for about 6 years. And in doing that work, that's when I really fell in love with medicine. And I just knew that I personally felt like I had a lot more that I could offer, and so I made that choice to go on and go back to college and get all that schooling done and go on to medical school. But then neurology specifically came along kind of for the same reasons, different aspect of what everybody else has already said, which is that as I went through my training, I found that the brain was the most fascinating organ. And one of the things that fascinated me about the brain was that, every organ, of course,
Hmm.
they're all complicated, right? There's a lot we don't know about all the whole human body, but generically you can see the heart pump, you can see what it's doing, and you can see the lungs inflate, and you can see the gut churn, and you can see the kidneys filter, right? You can see all these things happening, but the brain just sits there. When you look at it, it looks like it's doing nothing, but yet it's doing everything. And I just found that amazing. So that's kind of how I picked the specialty of neurology, and then ultimately stroke, and my subspecialty is in neurocritical care. And I think that also goes back to my roots of being a paramedic and loving all of that kind of emergency sort of urgent stuff. Really, the two kind of mesh together then, and that's sort of how I ended up doing a lot of, essentially it's neuro ICU kind of work, and stroke is, one big component of that.
Awesome. And how long have you been doing it now, since medical school?
So I finished my fellowship in neurocritical care. I finished my neurology residency in 2009. That was up in Chicago at Loyola University. And then I did my neurocritical care fellowship here at UC 2009 to 2011. So I've been a neurologist since 2011. And then at Jewish with this particular program for just over 4 years now.
Awesome. Okay. So you've got a little time in.
A little
Um,
bit.
A lot of time in.
I know.
right. So
It's
I'm
Yeah,
sad
that.
curious,
the
what are
day is
some of the
coming
risks?
where I'm sorry,
What
go
you say?
ahead. I was going to say it's sad because the day is coming where I have more time behind me than I think I have in front of me, but that's a
Mhm.
whole other story.
Right. We're all thinking about those
All
different
right.
times,
All
right?
right.
My dad had pancreatic cancer, and in his final days, I remember looking at my own mortality. Right, it's like I'm
Hmm.
40, and
Mhm.
I may have only 40 more years. Like I really need to
Right.
decide,
Yep.
Mhm.
That's right.
what that time looks like. So, we all want to stick around a little bit longer. What are some of the warning signs of a stroke? What are things that folks can be looking out for? Because I know how important it is for them to get help quickly, right?
Right.
Um,
Yeah, exactly. So when we educate the community in regards to stroke, our emphasis is on early recognition of the signs and symptoms of stroke and quick intervention, because that's been proven to show the best outcomes. So when we talk about stroke, we talk about the B fast symptoms of stroke, and that's BEFAST.
Hmm.
And I always tell people, when you think about the heart, the scariest thing about a stroke is, usually there's no pain associated with a stroke unless you have the hemorrhagic stroke, the bleeding
Right.
type of stroke. But that's only like 10 to 13% of the population. The majority of
Right.
people have the ischemic kind of stroke that give you these symptoms, and something is wrong, but it's very confusing. People can talk themselves right out of having a stroke all the time. So when we talk about the BFAST signs and symptoms, B is for balance. The B and the E are for posterior circulation strokes. So the B is for balance. And, stroke comes on fast. So, it's like these symptoms weren't there and now they're there, like immediately there. So people immediately have these balance issues. Well, they'll start saying that, I feel dizzy or lightheaded. I feel like I'm going to fall. I haven't fallen yet, but I just feel like I can't walk a straight line. They essentially feel intoxicated. They get all the bad effects of the alcohol and none of the fun effects, right?
right.
So, and then E is for eye. So some people experience acute onset visual disturbances where they'll just lose half of their world, right? We've had patients come in because they are driving down the street and they hit a series of parked cars on the street, and they're boom 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 boom, and they don't even realize that it's happening, but
Right.
that side of their vision has gone out, and then all of a sudden they're like, oh, what's going on? So it can be very tricky. And then the FAS are usually the most obvious signs of stroke, but they can be deceiving too. So F is for facial droop. So, and stroke is always one-sided symptoms. If you wake up one morning and you feel like generally fatigued, like both of your legs feel wobbly, or your arms feel like, something's going on, we're not really necessarily concerned for stroke. But if, you wake up and you're brushing your teeth and all of a sudden you're just drooling consistently out of one side of
Hmm.
your mouth, or you notice it kind of looks like one side of your face is melting off, right? You want to
Yes.
smile and you want to see if you have that facial symmetry throughout. You want to raise your eyebrows. Maybe one goes up and the other doesn't. And this counts for sensation too. So it's not only one-sided weakness, but it's one-sided loss of sensation and things like that too.
So you
So
won't feel anything on that side of
right.
the face.
Yeah,
Yeah.
sometimes, yeah. So you can have weakness and sensation deficits, or maybe one or the other, or both.
Yeah.
Um,
Oh no, so I'm sorry. Go ahead.
no,
And I was going to share that if I can.
yeah.
I can experience because I just ended up just with the right side weakness, and I think
Hmm.
that at the time it affected my left side, and it ended up on my right side weakness, which causes I have a, if you can notice, I have a weak eye.
Hmm.
I have somewhat of a slant smile.
Hmm.
Um, and when I realized I really had a stroke, I was going through a numbing and tingling through my
Yeah.
through my
Hmm.
arm, and I didn't know exactly. I was like, "Why is my numb?" And at the time, I didn't know what was going on until I arrived at University Hospital, and they was like, "Oh my God, her blood pressure is very high. She's going into stroke mode."
Right.
Um,
Yeah.
How did you know to go to the hospital, Joyce? Because I think that's
'Cause
that's the
I was
determining
feeling
factor,
weird.
right? A
I
lot of
was
people
told, like I
don't.
said, when I got up that morning, I kind of fell. And when I fell, I tried to get up again, and I just couldn't. And I just
Mhm.
laid there. So when I was right side, it was like a feeling that you couldn't control. Like I was trying to catch my balance, but I couldn't. And I was home alone, so that made me scared. So I remember calling making a phone call, and they was telling me that you need to call the ambulance. Just lay there, call the ambulance until I can get you to the hospital. And that's how I really feel. And by this time, I was drooling so bad, not knowing that I couldn't talk. I was trying to speak, and it wouldn't allow me to talk, and it was just the right. It was horrible. I think ended up having paralysis on my right side. But the stroke, they said the stroke affected my left side, but it ended up on my right side. So I ended up going through, like I said, going through 8 weeks of physical therapy, Edurate, for the paralysis on my right side. And I was told, like I told you, I was told to just practice. I had to practice on speaking, and I had to practice on doing things, and it wasn't normal because I was normally used to just blurting out. I'm sure you know that. Or I'm just I'm just used to talking to people correctly. Well, now, and sometimes I have to catch myself because if I speak fast, I have a slur. So it's a lot of practice, and I had to go through a lot of treatment. And, you know, I had to go through a lot of grieving and understanding, like, why me? I don't ever want to wish this on nobody. But, you know, thank God I am where I am now. And I think I'm looking pretty as ever. What you think?
Yeah.
Absolutely.
We agree. And I always say you let your test be your testimony. So that's why, Rachel, when you were talking about your daughter, I think a lot of times we go through different things in order to be that advocate, obviously, in order to be that resource to the people that we love or the people that we're, you know, encounter in just life changes and going along that journey.
Yeah.
So I'm curious.
Can I finish
what else were you going to say, Rachel?
I just wanted to, so it seems like Joyce, it seems like you had a very severe stroke where you had the F, you had the A for arms, which arms really arms and leg. That's one side of weakness, right? So that quick onset, one-sided symptoms. S is for speech. You know, people can get slurred speech. They can have trouble swallowing. They can become what we call aphasic, where, you know, they know what they want to say, but they can't get it out. It just sits on the tip of their tongue. It's so frustrating. Where sometimes they just get acutely confused, where you'll be asking them questions and they're looking at you like you have three heads. But T is for time. So when we talk about, you know, what the community can do is recognizing these symptoms and picking up the phone and calling 911 to get it fast, because, you know, we have all of these resources, and stroke is treated just like a heart attack. When you come in the hospital, we tell our patients, and when I go out to the community, I say, you want to pick up the phone and call 911 because they are the experts, right? They have all kinds of different pre-hospital stroke scales that they can use. And they have certain stroke scales that will tell them that you're experiencing a severe stroke that you might need. They might bypass a primary stroke center and come to comprehensive center like Jewish Hospital that can actually give you the clot busting medication, because we only have 4.5 hours from your last known well to give you that clot busting medication, because your brain, you know, gets angry. It can swell, it can bleed. And, you know, we have this skull protecting our brain, but unfortunately it doesn't allow for a lot of expansion. So things can get dangerous quickly. But we have 4.5 hours to give you that clot busting medication. But if you have what we call large vessel occlusion, our endovascular surgeons can go in through your groin, one of your major arteries, and pull that clot out. So, you know, but, you know, when they say brain is time, we truly mean that. We have 4.5 hours from your last known well and 24 hours from your last known well to actually get that clot out, to get that reperfusion.
Yeah, for a long time, where I am now, it was worse than this. You know, I used to walk past and I used to hear people say, "Oh, look at that lady. What's wrong with that lady's face?" Or, "Oh, look at her." You know, and it was real scary because I knew to myself that it wasn't normal. But I could hear you saying it, so it used to bother me a lot of times, and I couldn't react because I couldn't speak at the time. This is when my stroke first occurred.
How long do you think it took to feel normal again?
I guess it took almost with therapy and with medications and with seeing my doctor and doing and practicing my right diet. It took me about at least 2 or 3 years to get to actually feel normal again. You know what I'm saying? It took me a long time to not stereotype what people think or say or feel, because I'm truly blessed that I ended up from the stroke, you know, because I did a lot of research on it, and I'm truly blessed that I just have just the right side weakness of you know, the you know, the limp eye and the twisted lip, because I still, and you know, as long as I can still smile and say hi, you know, I can take this eye off. I can just wink at you a little bit, and you won't even notice.
And what are the percentage of people that don't walk after stroke? Because I know that that's a comment, you know, that you can be completely paralyzed, right? If you don't act quick enough, Rachel.
Yeah.
Or Dr.
Well, I'll let Dr. Kachoris.
Yeah. So, right. So I can say a couple things about that and kind of to tie all of this together. So, you know, stroke is unique. The reason why it's not like a heart attack, right? Where everybody knows chest pain, heart attack, go to the hospital. And that's why we have this be fast kind of mnemonic, because it catches some of the main symptoms of a stroke, right? But stroke is all people always want to know, you know, doctor, is this a large stroke? It's like, well, it's all about what it did to you. That determines how bad or big of a stroke it is, because you can have a very small stroke in a very eloquent or sensitive part of the brain, and that can be it, lights out, right? Or you can have a large stroke in a part of the brain that's not necessarily showing so many outward signs, and sometimes people don't even realize they've had a stroke. So stroke is like light switches, right? Wherever you have a stroke, it's like turning off the light switch. So whatever switch it hits and whatever part that of the body that switch controls, that's what's going to stop working. So you certainly could have a stroke that's going to paralyze you down your whole side, and you're never going to use that side again. Or it could be one where it starts out that bad and then it can improve. And a lot of that just has to do with where the stroke actually is and how much brain is actually involved.
Correct.
Joyce, you're a case in point, and what I tell people all the time, that all stroke gets better. It's just a matter of how much and how fast. Right? Because the more, and the brain after a stroke, just like with any brain injury, is primed to learn a new thing, because the brain that's damaged doesn't really ever heal. What happens is the good brain around it is able to kind of learn a new thing, right? This is a trick that only the brain can do. This is like when you cut yourself, your skin heals good as new, like nothing happened, right? The brain can't do that. But what the brain can do is take on a new role. So that's like skin becoming bone, right? Just changing into something else entirely. And that's how stroke recovery, any brain injury really happens. And what the advantage of rehab is, you know, sometimes people will tell me, it's like, I'm not going to do rehab. I'm just going to go to the gym and I'll do exercise. I'll get my arms stronger. And it's like, that's not the same thing, because what you're doing with rehab, it's very tailored towards trying to reactivate that brain to get it to learn a new thing. And there's a window of opportunity where that can happen. And if you miss that window, yeah, you'll recover, but it's not going to be as good as it was if you would have done the rehab and the very focused work that will, you know, get that brain to kind of kick in. And so we don't say that somebody is, from the brain recovery standpoint, as good as they're going to be after a stroke for at least a year. That's how long this can take. It goes, you know, it'll be faster at the beginning and then it slows down. But if someone is not back 100% at, you know, 9 months, you still got 3 months to go where you're going to see solid improvement. Then after a year, you're probably stuck with whatever kind of physical difficulty that you still have from it. But Joyce, you're a case in point to how stroke affects you in more ways than just the physical, right? It affects you emotionally and mentally, especially as you were telling your story about, you know, you had to come with terms to what you could and couldn't do the same as you used to, how people looked at you different, how you were going to say, you know, that's not about me, that's about them, you know, and so there's a psychological aspect too that hits people hard, and that can sometimes take forever, right, for people to get through. So, you know, Joyce, you're a great, you know, testament and case in point to how
Thank you so much.
You're welcome. Hard work pays off, right?
It did.
I tell people all the time, you know, it's like all the little adages we hear all the time. If you don't use it, you lose it, right? Yeah. So, and, you know, and I tell people with stroke too, brain injury in general, it's like the more you do, the more you can do. Stroke victims, stroke patients, brain injured patients in general can be their own worst enemy, because it gets frustrating, right? It gets real hard day after day to be dealing with this. And then at some point, sometimes people will say, forget it. I'm done. I'm not doing this anymore. Well, now you've just become your own worst enemy, right? Now you're going to just go downwards. So to
Well,
find that inner strength
I'm
is
sorry. I had
huge.
to do a lot of praying. I had to do a lot of therapy. I had to do a lot of, like I said, I had to do a lot of chewing gum. Now today I do have artificial tears all the time. You know,
Yeah.
and it's something that, somebody might be saying, well, Joyce, what are you crying for? They're just come. If I look at something, a picture too long, my eye will run. Or if I read something and it's real long, I have this artificial tear. Well, what I was diagnosed and told is that it's not going to never go away. It was part of the right side weakness from the stroke, that I did have to have artificial tears because I didn't have any at all when I first had the stroke. So I want to look at it as, I wouldn't wish this on nobody, but it happened to me, and I'm ready to just share the world that you can overcome it. You just got
Right.
to, have a positive mind. I was thinking that, oh, I don't want to be like this for the rest of my life. So what is it I can do to make myself better? Like I said, I have right side paralysis. I had a walker. Now I can do the boots on the ground now. How about
Right.
Right, we
that?
got to come out as warriors. So, in our last 4 minutes, I want you guys to share resources so that way, if somebody is, being faced with stroke, that they don't look at it as, a death sentence or the end of the road, but they look at it as
Exactly.
a way to come out fighting, to be
Yeah,
able to come out on the other side, like Joyce doing the boots on the ground.
I
So,
know. I mean, Joyce, you have such an amazing testimony and such an
Thank
amazing
you.
story to share.
Thank you so much.
We have at Jewish Hospital, we have a stroke support group that meets the second Tuesday of every month from 6:30 to 7:30.
Okay.
We have contact information. I'm not sure that hopefully Toya will be able to put that up after the show.
Okay.
But you're more than welcome to reach out to me directly at rtcampbell@mercy.com for that information.
Okay.
There's the Brain Injury Association of Ohio that is a statewide network that is a 24/7 helpline that you can call to get in contact with local support groups. It offers educational programs in regards to stroke and brain injury for survivors and caregivers. A great place to start is the American Stroke Association, which is a division of the American Heart Association. If you go to www.stroke.org, you can also find support groups there online and tools that allow users to search for those groups by zip code. And then they provide access to both in-person and virtual groups. The Greater Cincinnati Stroke Consortium is a wonderful program that I'm an active participant in. It's a team of doctors, nurses, therapists, and other medical professionals that go out to local community events and spread the stroke word. We
And that's
constantly
what I would love to do that. I would love to spread the word.
yes, absolutely. And we have stroke survivors that participate as well. But we spread stroke awareness and we educate towards the BFAST signs and symptoms of stroke and the importance of early recognition and getting treatment fast. And then the last resource that I have is called Reach Me, which is a nonprofit organization that promotes community inclusion by offering socialization opportunities to adults with developmental and intellectual disabilities. So you can contact them on their website at reach-me.info. But support after a stroke and, really leaning on the community around you is so important. Because mental health, is, it's important and it
it's
can
key.
really kind of like leave
So
you stagnant in a really bad place.
Right.
Stroke is the fifth leading cause of death in the United States, but it's the leading cause of adult disability. So it
So
can be devastating.
one thing I want to add then right here at the very end is the best way to treat a stroke is to prevent it in the first place, right?
Exactly.
You've got the sense of how hard this recovery can be. And depending on how much damage you get to your brain, it's going to be variable how well people are going to do. And as Rachel just said, it's the leading cause of disability. So the best way to deal with a stroke is to prevent it, which means you've got to control your stroke risk factors, which is all the reason why we're supposed to go to the doctor every year, because it's the silent killers that cause vascular disease, which cause stroke and heart attacks. And those are high blood pressure, high cholesterol, diabetes, and smoking. Those are the primary ones. People can have all of those, even the smoking, completely out of control, and you would never know it unless somebody checks, because you don't feel the effects of those until it's way too late. So annual visits to your primary care doctor and get those things under control, and that's the best way to treat a stroke.
Right. And Rachel, I want to thank you. I want to thank you, Rachel, for the resources, because when I had my stroke, I didn't have any resources. I had to go through what I had to go through by myself, with a lot of prayer, with a lot of believing and a lot of trusting that that I just had to do it. We didn't have a resource. I think I went to a university hospital neurology clinic for a long time, and doing that, like me trying to do research on my stroke and what I could do to get better. We didn't have a lot of resources. So, and it's been a long time since I've had it, you know what I'm saying? So I'm willing to just share my story with anybody, right. and thank God that I am able to recognize a stroke. I think a young lady had a stroke at my job, and I was just able there to aid her and just, tell me that they just need to call 911, because she just fell out. Her whole right side, she was like, Joy, she had told me at lunch that her right side. I said, girl, you don't play with that. I said, that could be a sign of a stroke. She said, no, it ain't. I went to clock out to go to get my children. Next thing you know, the ambulance was coming to pick her up off the ground.
Yeah.
Absolutely.
Well, we appreciate you guys sharing your stories and sharing your resources. It is at 7 o'clock, so we're going to go ahead and thank our sponsors. Again, we appreciate you, and we're going to go ahead and thank our sponsors now. Thank you, guys.
Thank you very much.
Bye-bye.
Bye.
Today's episode of The Plug is sponsored by the following companies. At the platinum level, we have MediLift. MediLift uses advanced drone technology to deliver prescriptions quickly and reliably. Partner with them to streamline healthcare logistics. Contact them at mediliftdrone@outlook.com. At the gold level, we have Leafy Products. Leafy Products is the first Black-owned sustainable toilet paper company in Ohio. Do your part to go green and stay clean. Purchase today at getleafyproducts.com. At the silver level, we have Relate Sensi. Relate Marketing DBA Relate Sensi is a local 501c3 founded to help the community imagine a broader set of career possibilities through experiential learning, while also encouraging parents, business leaders, and community members to share their knowledge, resources, and time. If you're interested in getting involved or learning more, go to relatesensi.org. Last but certainly not least, at the bronze level, we have When Tomorrow Never Comes. When Tomorrow Never Comes is a self-help book written to help people overcome childhood trauma and walk into their purpose. You can find them on Amazon.com. Take the first step on your healing journey and purchase your copy today. The Plug thanks all of our sponsors for helping us keep you connected.